we've had a huge and diverse range of thoughts and opinions expressed today, and I'd just like to pick out a few highlights. One of which I think was the embarrassed silence that we heard at the beginning of the room after Robert made his introduction and reminded us on some of the experiences of poor care at Midstaffs and indeed in other places. It was uncomfortable for you as nurses, and I think although many of your organisations I hope wouldn't be in that same category, and you're in a different part of the normal distribution that Catherine presented, I think as Jill Heaton said, we are no longer the angels and we all have to take some ownership of the solutions from here on in. We heard a bit about this question of what is it the nurses do, and that patients were confused by what they see and what they experience. It's not always clear on wards who's a nurse and who isn't. That whole debate may need to shift because there are other ways in which care can be organised, there are other members of the team, so it's not something that's static and may need to be redefined. We talked about the role of healthcare assistants. There were different views about regulation and indeed what you mean by regulation. I think as the group here has indicated, there's much more commonality and consistency that people would like to see around job titles, competencies and training. There's more of a debate about whether the next step is also needed about formal registration. And linked to that, it was also important that you highlighted that nurses are reminded of the conditions of their registration, about their roles in delegation to others that support them. And we heard from a lady up there around perhaps some clarity about the red, amber and green zones, about what it is and is not acceptable to delegate. We had quite a lot of debate about the way that wards are staffed, that may need a rethink, the use of predictive tools, rethinks about the tasks, tools such as a productive ward, opportunities for skill mix and minimum staffing. No single solutions, context specific, but more of a science around it that needs to be reinforced, I think. The fourth theme that I picked out was the role of ward managers. Hugely important, but we've heard a few points today about perhaps too much is expected of them, too much is burdened on them. But we've also heard some of the keys to how those roles can be enhanced, making them supernumerary, providing leadership to people leadership development before they go into those roles, and crucially supporting them when they've taken up those posts, and then challenging them to go to continually improve. And Jill's examples of the award accreditation scheme was designed to do exactly that. We've heard lots of discussion about the need to refocus on behaviours, what's desirable, acceptable and crucially non-acceptable, and for the profession to make sure that the non-acceptable performance was weeded out. And we heard also a suggestion that perhaps those behaviours perhaps ought to be reflected in the re-registration requirements. We've talked about training and development of nurses, and I think the sense was that having a graduate profession was the right way to go, but there needs to be far more done around how nurses are supported in learning about basic care in the ward environment, and that there needs to be a stronger partnership between universities and employers around the curriculum and how they demonstrate that competences are achieved. And then finally, we've heard a lot about nurse leaders, whether it's about nurse directors, whether they're chief nurses or non-executive directors, how they're supported in their roles, and the very important role that chief execs play in reinforcing their role and status within the board, within their organisations, and emphasising again that it's not just nurses in isolation. They are there as members of clinical teams, and the more that we can see our boards having a majority or a significant proportion of clinicians on those organisations, the more that those conversations will shift and be more around the clinical issues and delivery of care to patients. So those are just some of the things that I pulled out, and no doubt you'll also have your own points to take away.
I'm old enough to remember when nurses were not only angels, they were a group of people who could do no wrong at all, so far as the public was concerned. It merely had to be suggested by the nursing body that things weren't quite right, and politicians fled for cover. I fear those days are past, and in that respect I would counsel you not to despair, because it merely means that you join the rest of more mortal humans, of whom right at the bottom of the food chain come estate agents and lawyers. I say that for this reason. Professions, and we are all in professions here, survive on their reputation and the confidence in which they are held by the public. If those aspects are lost, society loses, and it becomes exponentially more difficult to do the jobs that people have vocations to do. A striking figure I thought we heard today was the implication of a survey that suggested that 80,000 people in a particular period of time were not satisfied with the care that they got. Because what we have to remember is that it's not just the 80,000 people who are not satisfied who then have a different view of the care they get, of the nursing care or whatever. They're all their relatives, they're their friends. And the result of that is, I'm sure, is something we all know of in our own lives, and we've all, some experiences have been mentioned today. But I'm sure we can all count, or more unhappily than the fingers of one hand, the people who talk to us in our families or amongst our friends about bad care they've had in places. Now, of course, those experiences are probably a tiny minority of the experiences of care within the healthcare service, but they have an exponential effect. So it must be quite right, and I think there's a consensus here, that we could never be satisfied with a figure of 85% or 95%. We shouldn't be looking at it that way. It is very unfair on the 95% that there are the 5%, but there are the 5%, and until we aspire to get rid of that 5% and turn it into the other side of the equation, I'm afraid the battle will never be won. In this room, I sense, and I've been really grateful for the speakers and the contributions that have been made, not only are the great and good of the profession, the nursing profession, but also as a group of people, that if you put your heads together and you got out there from your palaces of good practice, you personally could turn round lots of other places. You know lots of people who behave and act as you do. I'm quite convinced of that as well. And frankly, it is people like yourselves who can do far more about turning this problem than any report I can issue or any particular action that could be taken by the Secretary of State. So the start must be the people there. But my experience of Stafford and the problems that were there was that was the very opposite of what I've just described. It was an organisation at the time that looked inwards. It denied its problems. And I'm afraid Colin may want to nod or not, as the case may be. There are many places within Stafford where the problems are still denied because some people can't go to work in the morning and accept that the issues are as enormous as they probably are. So we want, I would have thought, to reconnect the nursing profession as a whole so that the values that you all aspire to and everyone else thinks they aspire to become the same. And one message perhaps I got today, which has slightly surprised me, is I sense perhaps a need to think again about how nursing is described, how there is more clarity about what nurses do and what those who are not nurses perhaps do. So I take away from today a positive experience, and a feeling of optimism that problems can be solved. But what I wish to emphasise is that it's not me that's ever going to solve them, fortunately, it's you. Thank you very much for coming today, and I have been immensely helped by what you've had to say.